I'm Tia Brumstead, Deputy Assistant Superintendent of Health and Wellness at the DC Office of the State Superintendent of Education. Over the next few minutes, I'm going to explain the process and results of the District of Columbia's work to improve behavioral health systems in our public schools. In 2017, the city established the Task Force on School Mental Health. This task force was charged with reviewing and making recommendations regarding the submitted comprehensive plan to expand school-based behavioral health programs in all DC public schools and public charter schools. The task force members were appointed by Mayor Muriel Bowser and the chairs of the DC Council Committee on Health and Committee on Education. Membership included a parent of a public school student and a parent of a public charter school student, school behavioral health providers, community-based providers, and government representatives, among other stakeholders. For a full list of members, visit the website you see on your screen. The task force met for 5 months before presenting its report to district leadership in March 2018, which included 6 main recommendations. The first was to use existing data to identify student behavioral health needs for all district public and public charter schools, and use that data to rank schools based on the estimate level of student need. Second was to prioritize implementation of services in year 1, which was school year 2018-2019, to the top 25% of schools with the most behavioral health needs. Third was to ensure schools could provide a full continuum of supports, including prevention, early intervention, and treatment services, whether through school-based teams consisting of school-hired providers or in partnership with community-based clinicians assigned to interested schools. Fourth was to support successful expansion of school-based behavioral health in the district through the development of a community of practice and provide technical assistance to help providers and schools increase their readiness and capacity to implement the new behavioral health model. Fifth was presentation of several budget options for the city to consider to fund components of the expansion that are not billable services, but still considered essential components of comprehensive school behavioral health program. And sixth was to create an effective governance body and/or a structure that holds agencies and partnering stakeholders accountable for timely implementation of what is now known as the comprehensive school-based behavioral health system. The sixth recommendation was aligned with the planned oversight committee of interdisciplinary leaders, which is now called the Coordinating Council on School Behavioral Health. This group is led by the Department of Behavioral Health and makes recommendations for the money budgeted for the initiative and guides implementation of the processes and activities necessary to strengthen the city's school behavioral health system. The coordinating council members formed 4 committees to help address challenges and priority areas: Family and Youth Committee, Data Evaluation, Unmet Need and Resource Committee, Implementation Committee, and School and Provider Readiness Committee. The coordinating council meets monthly and the meetings are open to the public. For more information, visit the website on the screen. So in short, the school behavioral health expansion aims to ensure that every school and student will have access to comprehensive school behavioral health services and support. A key factor in its success has been connecting with community-based organizations, what we call CBOS, to supplement the services and supports already available through school-hired providers. As we will discuss, over several years, the CBOs will place a clinician in each school full-time and integrate those services with other available programs and interventions. The expansion requires that behavioral health providers support interventions in schools at all levels of the multi-tiered system of support. Tier 1, universal prevention strategies, Tier 2, targeted intervention strategies, and Tier 3, selective intervention strategies. This means that providers are actively involved in schools to help promote prevention, early identification, and treatment-related activities. Training, services, processes, practices, and policies in order to advance a nurturing and safe school environment so that all children can learn and grow. In order to best meet the needs of schools with the resources available, the Coordinating Council decided to implement the school behavioral health expansion in phases. Schools were ranked based on available data related to student academic, social, and economic risks. Cohort 1 schools included the top 52 schools with the highest estimated needs, and Cohort 2 included an additional 67 schools, for a total of 119 schools that were invited to participate in the expansion during the 2019 school year. Cohort 3 schools included 47 schools that were invited to participate in the expansion in the 2020-21 school year. In addition to work directed by the Coordinating Council, in 2018, the Office of the State Superintendent of Education, or OSSE, launched Project Aware, a 5-year federally funded grant program awarded to the district. Project Aware has allowed for further investment in our school-based behavioral health infrastructure by promoting youth behavioral health awareness and improved connections to services for students and families who may experience behavioral health issues. With state-level coordination from OSSE and DBH, Project Aware supports participating local education agencies to build fully resourced schools that provide students with access to needed prevention, early intervention, and intensive treatment services. Key elements addressed by Project Aware include developing trauma-responsive learning environments and improving mental health knowledge among students, parents, and staff. In addition to Project Aware funding and resources from the district government to support the expansion, the Coordinating Council recognized that in order to sustain their work in schools, CBOs needed financial support to subsidize clinicians engaging in Tier 1 and some Tier 2 strategies that are not reimbursable through traditional funding mechanisms. The Coordinating Council recommended a measure to offer grants to selected CBOs that cover half of the effort of a full-time provider and a portion of the costs associated with clinical supervision. The Coordinating Council also recommended the Department of Behavioral Health receive funds to implement and manage the expansion. Funds were also provided to develop a community of practice, a contract that has been awarded to the Center for Health and Healthcare in Schools at the Milken Institute School of Public Health at the George Washington University. Additional funds were provided to conduct the evaluation of the expansion project, a contract that was awarded to Child Trends. We hope this has given you some helpful information about the expansion of school behavioral health services across DC public and public charter schools. Thank you for watching.